Welcome to the Floyd Memorial Library podcast, where we sit down with the people who give shape, texture, and voice to life on the North Fork of Long Island. Some are rooted here by generations, others arrived by chance or choice, but all carry with them a piece of the story. We talk about what's changing, what's worth holding on to, and the currents of history, both quiet and loud, that run through this place. I'm your host, Christopher Bianchi, and in this episode, we're diving deep into a critical topic that affects countless lives, but especially matters here on the East End, where timely care can mean the difference between life and death. Dr. Candace Cummings is a hospitalist at Stony Brook, Eastern Long Island Hospital. She's here to help us understand what it means for Stony Brook, Eastern Long Island Hospital to become a primary stroke center, and why that's such an important step for our region. We'll explore what a hospitalist actually does, how stroke care works behind the scenes, and what happens from the moment a patient walks through the hospital doors to the start of recovery. We'll also talk about warning signs, the Be Fast acronym, and how a local hospital like Stony Brook Eastern Long Island Hospital is preparing for and already delivering life-saving stroke care. If you've ever wondered what health care close to home really looks like, or why it's so essential, this episode will bring you inside the story. So I hope you enjoy episode 120 with Dr. Candace Cummings. This episode was recorded April 10th, 2025. Welcome to the Floyd Memorial Library podcast today. Thank you so much for coming on today.
Thank you for having me.
Absolutely. And just in the beginning, could you tell us a little bit about how your role got started at Stony Brook?
Okay, sure. Hi, everyone. My name is Dr. Candace Cummings. I'm an internal medicine physician who serves as the Vice Chair of Medicine and also hospitalist at Stony Brook Eastern Long Island Hospital. My major role, in addition to the administrative role, my major role is really to care for and treat all patients who are admitted, hospitalized at Stony Brook Eastern Long Island Hospital. I also will serve as a consultant for those patients that are admitted to our psych, detox, and rehab units.
And many people might not be familiar with the term hospitalist. Can you explain what a hospitalist does and how your role differs from a primary care physician or a specialist?
Oh, sure. Absolutely. So a hospitalist is a physician that only treats patients that are hospitalized, that are admitted to the hospital. A hospitalist do not have office hours, do not treat patients outside of the hospital, and we're not ER doctors either. So when an ER doctor sees a patient and says, this patient needs to be hospitalized, that ER doctor will call the hospitalist. That's who I am. That's the role I serve. And I will go down to the emergency room, admit those patients, and treat those patients in the hospital. A primary care doctor is one that treats patients on the outside of the hospital. They treat non-hospitalized patients in their offices. They have office practice, and they build that relationship with their patients. Prior to, I would say the hospitalist program really kind of took off about 20 years, over the last 20 years. But prior to that, I actually served as a primary care doctor. I'm an internist, an internal medicine physician who is that GP, the primary care doctor. And before, 20 years ago, I actually served both roles where I saw my patients on the outside in the office practice, and if they were admitted to the hospital, I saw them in the hospital. So that was the practice years ago. When you look back, 30 or more years ago, that was the model. But the model today is really your primary care doctor that are treating physicians on the outside. And then you have the hospitalists who are treating patients once they become hospitalized.
Okay.
But of course, we stay in contact with each other. The specialists now are those physicians who are specialized in their field. And those physicians, whether they're cardiologists or pulmonologists, they will see patients on the outside in their offices on the outside, but they also come to the hospital. So for example, if I have a patient who have a cardiac problem, or I may have a patient who has a pulmonary problem, and I want that patient to see a specialist, I'll call the pulmonologist, I'll call the cardiologist. He or she will come in, see that patient, and then leave and go out back to their office practice versus a hospitalist. We are there 24/7 in the hospital, and we usually work in shifts, 12-hour shifts. So there's a hospitalist that's on during the day, and those hours are usually 7 a.m. to 7 p.m. And then you have the nocturnist, that's the hospitalist that comes on at night, who takes over from 7 p.m. to 7 a.m. And that's usually the standard model that most hospitals use. And that hospitalist is on for 7 days straight, and then they're off for 7 days. And when you look across the United States, that's really the model that most hospitals use, and that's the model that Stony Brook, Eastern Long Island uses.
Wow, that's a lot. And it's interesting that working 7 days and then off 7 days. But in terms of, for Stony Brook, Eastern Long Island Hospital, they're on the path to becoming a designated primary stroke center. What does that mean for our hospital and our community?
That's right. We are on the path of becoming a stroke center. And I think it's great for our community. It's great for our hospital. It means that our patients in our community will receive better, more improved quality and coordinated acute stroke care. It means that the healthcare professionals at Stony Brook, Eastern Long Island will be specially trained in emergency stroke care. It means that Eastern Long Island Hospital will have a more cohesive stroke team. There will be an established, consistent approach to stroke care, which in turn will reduce the risk of errors and delay in treatment. In essence, it means that the stroke outcomes will be better for our community, for our patients.
And just from your perspective, why is that? You mentioned a bit about the importance of having it out here, but why is it important to have it available locally, especially on the North Fork?
Oh, absolutely. Well, we know the North Fork, it's considered more of a rural area, and we do lack certain services because of the location. So I believe it's imperative that the acute stroke care is available on the North Fork, because when it comes to stroke, every minute, every second matters. It counts. So it's important to recognize the symptoms of stroke, to have a rapid evaluation and treatment. We have a small window, a 3-hour window to recognize and treat a stroke patient. So when you have a local hospital in a community like here in Greenport that serve this area, that means that patient does not have to travel, greater than 30 minutes to receive that care that he or she may need. So having an acute stroke center in your community is vital. So I think it is important. It is critical because the time frame is critical. So if you have an acute stroke, center in your community, when you get there, from the time you hit the door to receiving that treatment, it matters because your outcome will be different. It will be better if it's recognized earlier and treated earlier. So that means our patients won't have to travel 30 minutes or greater when that time matters. They won't have to do that long travel to get that necessary treatment, that critical treatment that's needed.
Yes. And could you walk us through what would happen when a patient with stroke symptoms comes through the door? And what does a rapid response look like?
Okay, great. That's a great question. So what does that mean? So a patient comes in to Stony Brook, Eastern Long Island Hospital, or let's say we get that EMS call that there is a patient, a possible stroke patient on his or her way. There is what we call a code BAT. That's what we call it at Stony Brook, Eastern Long Island Hospital. That's a stroke alert system that we have. So that code is called overhead. And what does that mean? It means that the code team is activated. That includes our ER physicians. That includes actually the entire ER staff or ICU staff. It also includes the hospitalist that is on that day or night. We are all alerted. It also means that the CAT scan tech is also alerted. That CAT scan tech knows that he or she must clear the CAT scan and prepare for that patient. In addition to that, because we do not have neurology in-house at Stony Brook Eastern Long Island Hospital, our neurologists are at Stony Brook Main Hospital. That team is also alerted. That's our telehealth neuro team. They're alerted, so they are aware. So once that is activated, that's the first thing, because now the entire team is aware. Once that patient hits the door, it means that that patient is being assessed by a medical doctor, and that's usually the ER doctor, that then sees the patient, does a quick evaluation of the patient, labs are drawn, IV is placed, EKG, the patient is placed on a monitor, and that patient goes straight to CAT scan. That's where the patient will then get a CAT scan of his or her head without contrast to rule out, because the first thing you have to rule out is a hemorrhagic stroke. You have to rule out a bleed in the brain. Once that's done, that's been ruled out. The next step is, and it happens right away, it's done, seconds. After one is done, the next one is done. That is the CTA of the head and neck. So the CTA of the head and neck is a special CAT scan with contrast. And what is that looking for? That's looking for any evidence of aneurysm, and specifically also in the case of an ischemic stroke, you're looking for an occlusion. Is there an occlusion, a blood clot there in the brain, in that blood vessel that needs to be treated right away? So once those things happen, CAT scan is done, the patient comes back to the emergency room department. In the emergency room department, that patient is then seen by the telehealth doc, the neurologist, who assesses the patient and then gives instructions in terms of treatment guidelines. And that window, it's critical. So at Stony Brook Eastern Long Island Hospital, we're pushing for that 45 minutes from door to treatment. When you look at the standard of care and the recommended time is 60 minutes. And I will say, since we have started the process and we are, on our way to becoming that stroke center, just recently we had a patient came in to the ER. Between arrival to the ER and received the treatment, which was 45 minutes, and that patient was then shipped off to Stony Brook University Hospital for additional care. And I'll talk a little bit more about that.
Yes. And also, just what does the role of the hospitalist play in the care of stroke patients from diagnosis to discharge?
Okay. So the hospitalist is a part of the code BAT or stroke alert team. So we are aware of what's happening. So we go down to the emergency room to see how we can assist our emergency room doctors. But also when we're down there, we know the history of the patient. We know the history of the presenting illness. So being a part of that team now makes an easy transition just in case that patient, let's say the patient refused a transfer to Stony Brook University Hospital, or let's say that patient is outside of the window in terms of treatment. So it's been longer than the 3 hours when that patient comes in, and now that patient requires additional treatment for stroke. That patient may be admitted to our ICU and receive treatment that he or she still needs in terms of recovery from the stroke. So we do play a role in that. In addition, we may have a patient on our medical floor who suffers a stroke. And that has happened in the past. So we are the ones now that are in charge instead of the emergency room. It is the hospitalist that's now running that code team, that code BAT team. And the same process happens, as I mentioned, from the ER, where that patient, the entire hospital is alerted that there is a code BAT, but it's on the medical floor. The patient goes down to CT. Neurology at Stony Brook, Maine is notified. The telehealth, consult is obtained. They're able to see the patient. Let's say that patient did suffer an ischemic stroke. We do give that patient the thrombolytic to break up that clot and ship that patient out to Stony Brook, Maine Hospital. And I'll talk to you a little bit more about why that's important that those patients get transferred out to Stony Brook, Maine Hospital.
Yes, because you mentioned that a bit in terms of bringing cases over there. But yeah, if you could talk a little bit more about the collaboration between the Maine Stony Brook Hospital and higher level of stroke care cases where they may need to be brought over there.
Oh, absolutely. So Stony Brook University Hospital plays a huge role in this. As I mentioned before, at our hospital, Stony Brook Eastern Long Island Hospital, we do not have an inpatient neurological team, whether that's the, neurologist, and we also do not have neurosurgery on staff here at Stony Brook Eastern Long Island Hospital. So we have to collaborate with the main hospital. And one of the reasons for that is whenever a patient receives thrombolytic therapy, there is a 6% chance that that patient may suffer a hemorrhagic bleed in the brain. It's 6%. It's a real, complication, but we must treat, those patients who do present with an ischemic stroke. If there's an occlusion, the treatment is the thrombolytic, but it comes with a risk. So there's a 6% chance. So because of that, the goal and the standard of care is those patients need to be in a tertiary center where there is a neurosurgeon if a procedure needs to happen to evacuate the blood from the brain. Also, if a patient suffered a hemorrhagic stroke where there is a massive bleed, that patient needs to go to a center where there is a neurosurgeon. And unfortunately, at Stony Brook Eastern Long Island Hospital, we don't. If it's a case where it's a minor stroke, we can handle that. If it's outside of the window, we will be able to manage that in collaboration with our telehealth, specialists that will be seeing the patients through a teledoc system. So we can do it that way. But if it's a major stroke, if it requires thrombolytic or there is a hemorrhagic bleed, those patients must be transferred out so they can get that standard of care, which may require evacuation of that blood within the brain.
Yes. And then also to talk a little bit more about education and awareness for our community. what are some of the warning signs of a stroke that you wish more people were aware of? And then also, can you tell us a bit about Be Fast?
Oh, absolutely. Absolutely. So recognizing the symptoms of stroke is critical. And it's critical because remember, I told you when it comes to stroke, every minute matters because you
Yes.
have that time frame. You have the 3-hour window where if you're having an ischemic stroke, that 3-hour window is critical. So recognizing the signs and symptoms of stroke, vital to our community. So I think education is key. And so I always push education. This is why being on here today is a chance to speak to our community about education, educating themselves about stroke, the symptoms of stroke, and stroke prevention. So Be Fast. That's a mnemonic that we use in the medical community. It's an easy mnemonic. Just think about Be Fast. When it comes to stroke, think of Be Fast. And Be Fast is, I'm going to give you the signs and symptoms of stroke because Be Fast is a mnemonic for you to remember the signs and symptoms of stroke. So B, meaning balance. So if you're having trouble with your balance, this is acute change. You never had a problem with your balance before. Suddenly, you're lost your balance. You are having vertigo. You feel like the room is spinning. You're ataxic. You feel like you can't walk. That's a sign of stroke. So B is for balance. E is for your eyesight. Do you have a change in your vision? Are you now acutely blurred where your vision perfectly fine? 20/20, sudden blurred vision. That's a sign of a stroke. Or double vision, or it might be loss of vision. That's a sign that you may be having a stroke. Fast, F, facial droop. You notice that you have a droop. You've never had a droop in your face. You notice a facial droop, that's a sign that you may be having a stroke. A, arm. You notice weakness, numbness of your arm. That's new. You didn't have that weakness before. It's sudden in onset. That's a sign that you may be having a stroke. S is for your speech. You notice my speech is slurred, or someone next to you say, you sound slurred. I can't understand you. Or you have trouble with your words, word finding. You have trouble speaking. You feel like you cannot get your words out. That's also a sign of a stroke. And then T, that means time. When we talk about time, it's critical. So that's a time to call 911 to activate the emergency service to get you the treatment you need. Again, Be Fast. Think about it. Be Fast. Your balance, eyesight. There's a change in your balance, your eyesight. F, facial droop. A, arm. If you have weakness, numbness of the arm. Speech, S, speech. You have trouble speaking. And again, T, time is critical. All right.
Yeah.
So Be Fast.
Definitely. No, that makes sense. And then also, what advice would you give community members about prevention or early action when it comes to strokes?
My advice is to remember that mnemonic that I just mentioned.
Yes.
Be fast. Be fast. Educate your family and friends about that mnemonic. Be fast. And remember to seek medical care immediately. Call 911 should you or a friend, a family member, anyone that you know, someone that you're around, they're displaying signs and symptoms of a stroke, call 911. Additionally, for me, primary prevention. Remember, I told you I was a primary care doctor. So primary prevention is also key. So knowing some of the risk factors, what predisposes me to having a stroke. Now you're having a stroke, you have those symptoms, Be Fast. That's considered now, we're going to do calling 911 and getting the treatment. That will be considered secondary prevention because now you're preventing a poor outcome. You're preventing that bad sequelae, that preventing permanent disability, right? That's where the Be Fast comes in. And that's what we consider secondary prevention. primary prevention now is knowing what will predispose me to getting a stroke. How do I prevent myself from even getting a stroke, right? So one is knowing the risk factors. What are the risk factors that predisposes me? So having high blood pressure, having diabetes, high cholesterol, being overweight, obese puts me at risk, right? Being a smoker puts one at risk. Having a condition called atrial fibrillation, that's an irregular heart rhythm, that puts you at risk. So knowing your risk factors also, if you had what we call a transient ischemic attack, where you may have felt, I'm a bit off, I couldn't, I had a moment where I had a loss of vision, or I had poor vision and it lasted for a short period of time. I went to the hospital. They evaluated me. They said, no, I did not have a stroke, but you might have had what we call a TIA, a transient ischemic attack. That puts you at risk. So knowing those things, these are the risk factors. So I'm more likely to have a stroke. Again, high blood pressure, diabetes, high cholesterol, being a smoker, obesity, atrial fibrillation. So now what can you do? The key here is knowing what the risk factors are. Now, how do I prevent myself from getting high blood pressure? I need to know my numbers. So when you go to your doctor, and I recommend everyone, you see your doctor at least annually. Right? Yes. If you have a chronic medical condition, it means that you may need to go in and see your doctor every 3 or maybe every 6 months. It depends on what that condition is. Mm-hmm. But follow up with your primary care doctor. Know what your blood pressure numbers are. Okay? Mm-hmm. The key here is to keep your blood pressure 120/80 or less. That should be your goal. So know that number, 120/80 or less. That's the goal, because if my blood pressure is higher, it puts me at risk for a stroke. Knowing my cholesterol level, I need to make sure I have, my cholesterol levels are down. I need that LDL, which is the bad cholesterol. I want that number less than 100. My HDL, which is the good cholesterol, that's protective of my heart. I want that number greater than 40. So asking your doctor and knowing those numbers. Now, let's say you already have heart disease. You already have had a stroke. You've already had, you're a diabetic. That number, that bad cholesterol, that LDL, you want that less than 70, ideally. Okay. So it's knowing your numbers and knowing what your goals are, right? Diabetes. So you want to prevent yourself from becoming a diabetic. The goal here is ask your doctor, what is my hemoglobin A1C? And your goal should be less than 5.7. I want that hemoglobin A1C less than 5.7. And that should be my goal. Now, if you're already a diabetic, your goal less than 6.5. There's still things, you have diabetes, you have a family history, you may be a type 1 diabetic. You cannot control that because it's hereditary, but you can still work on diet and exercise. You can do certain things to decrease those numbers to get them in an acceptable range that will decrease your risk of then having a stroke. All right. The other thing, your weight, your BMI, knowing what your BMI, your body mass index, and we all have phones today. You can Google BMI calculator. You put in your weight and your height, and it will tell you what your BMI is. And the goal for your BMI should be less than 25. Less than 25. Ideally, 18.5 to 24.9. That's the range. You don't want to be too slim, because there are other issues that comes along with that. But you definitely do not want to be overweight. You do not want to be obese. So knowing that BMI, remember, less than 25. So that should be your goal. Make sure you're exercising regularly. Exercise is so key. So at least 30 minutes a day, 5 days a week of exercise is important.
Yes.
Getting at least 10,000 steps in a day. Those things help. Staying away from processed foods, high sodium content foods, low sodium diet. Those things matter. Low fat diet, high fiber diet. Those are things that will help you. It will help decrease your risk of getting high blood pressure, diabetes, high cholesterol, it will then decrease your chances of developing a stroke. And make sure that you're following up with your primary care doctor. Additionally, just recently I had a patient come into the hospital because she has, her Apple Watch, and her Apple Watch told her heart rate was irregular and told her to go to the emergency room. Thank God she did. She had atrial fibrillation. Atrial fibrillation, the heart is not beating as it should. Clots begin to form in the heart. You end up with a stroke. So simple things as getting that app to monitor, your heart rate, the rhythm of your heart. It really matters. It's a matter of life and death. So I would highly recommend those things. So there are those things that you can do to prevent yourself from getting a stroke.
No, those are all really important things. And then also, what's one thing you wish more people understood about the care that goes on inside our community hospital?
That is the team of doctors, our emergency room department, our radiology department, our nurses and administration that are devoted to providing the best possible care for our patients on the North Fork.
Yes.
I think that's the one thing that I think is important for me to communicate to our community and about our hospital, our community hospital.
Definitely. And what excites you most about the direction Stony Brook Eastern Long Island Hospital is heading as we work towards stroke center designation?
What excites me the most is seeing the vision actually come to life, being brought to fruition, knowing that it's only the start of bigger and better things that's in store for Stony Brook Eastern Long Island Hospital.
Mm-hmm. And is there anything else you'd like our listeners to know about hospitalists, about stroke care, or about supporting the hospital's mission?
Again, I want you all to know that the physicians, the nurses, the administrators, our ER department, our radiology department, our entire medical team at Stony Brook Eastern Long Island Hospital are committed to launching the Stroke Center, and we look forward to more innovations, more resources being brought to our community. For example, we just hired a new surgeon on our staff who's trained in robotics and minimally invasive surgeries, and our cardiologists from Stony Brook University Hospital are now in the building at Eastern Long Island Hospital, providing excellent care to our hospitalized patients. And I know I am looking forward to having more specialists from Stony Brook University Hospital join us in the near future.
Yes. And also, you see a wide range of patients. How does stroke care compare to other conditions in terms of urgency or coordination?
So as a hospitalist, we see a wide variety of medical conditions, but other than the code blue, that's a patient who goes into cardiac arrest, and a STEMI patient, that's a patient who suffered what we call ST segment elevated myocardial infarct. That's a really serious heart attack. And that patient is at risk for cardiac arrest. Our stroke care is one of a few medical emergencies that is time sensitive and requires a high level of urgency and coordination. So I would rank, I should say, stroke care up there with our STEMI response and our code blue cardiac arrest response. All of those are critical when it comes to the care that a hospitalist will provide our patients. Those are high level of care and time sensitive, and every second counts.
Yes. How do you and your colleagues prepare for stroke emergencies behind the scenes? Are there drills or special protocols in place?
Absolutely. There are drills and special protocols in place. We do have weekly stroke alert drills that all of our staff members are aware of and are a part of. So every medical professional there at Stony Brook Eastern Long Island Hospital, every professional there we are receiving the training that we need. In addition to that, as a one of the physician on staff, we are required also to complete stroke CMEs. And what that is continuing medical education when it comes to stroke treatment and prevention. So we are required to complete CMEs in addition to having those weekly drills.
Mm-hmm. And also the journey doesn't end in the ER. How does stroke recovery begin at the hospital, and what does that process look like for patients and their families?
So post-ER stroke recovery begins with the critical care treatment. So for those patients that do not require to be transferred out and as I mentioned before, because of the risk of bleed, they need to be monitored at that tertiary center like Stony Brook University Hospital. And this is not just isolated to Stony Brook Eastern Long Island Hospital. At any other center, it doesn't matter, that center, once a patient receives thrombolytics, if there is not a neurosurgeon on staff, that patient is getting transferred to that tertiary center that has, I should say, a neurosurgeon on staff. Mm-hmm. So that's not just isolated to Stony Brook Eastern Long Island Hospital. That's nationwide. So I do want to make that point. But for those patients who are going to post-stroke patients that are going to remain at Stony Brook Eastern Long Island Hospital, that recovery starts with that critical care treatment. So those patients are going to be in our ICU. They are going to be receiving telehealth neurological consultations daily. Mm-hmm. Maybe more than once a day, depends on their situation, their case. They are going to be monitored continuously with telemetry monitoring. Their blood pressure, their vitals will be monitored very frequently in an ICU setting. They're going to receive frequent neurological exams. They're going to have a PT, an occupational therapy evaluation. They're going to have that speech pathology, speech therapy evaluation as well. And these are just to name a few things. And the families are going to be a part of that treatment regimen, because it will take a village then for that patient to then recover from the stroke. So it's not, one component. It will take a team approach to treat those patients post-stroke, post-ER treatment and evaluation.
Yes. And as someone on the front lines of care, what has it meant to you personally to be part of building this new stroke center at Stony Brook Eastern Long Island Hospital?
I'm so proud and privileged and honored to be a part of the team that will be instrumental in getting our Stony Brook Eastern Long Island Hospital designated as a stroke center. It's a humbling, experience, but it's also an exciting time for us at Stony Brook Eastern Long Island Hospital.
Definitely. And then we often talk about healthcare close to home. How have you seen that make a difference in patient outcomes here on the East End?
So, yes, healthcare close to home, it does matter. Having access to healthcare, not having to travel more than 30 minutes to receive healthcare, plays an enormous role in our healthcare outcomes.
Mm-hmm.
So absolutely, I think it's vital. And also, I have seen it. For example, just recently, she served on staff at our hospital. She was working that day a few weeks ago. And one of the nurses, because of the level of training that our staff is currently receiving as we prepare to get that designation as a stroke center, she recognized that her co-worker was having a stroke.
Wow.
She activated the code BAT, our stroke alert system.
Yes.
And like I said, she's a member of our staff. She was down in the ER within minutes. She got her CAT scans. She got that telehealth neuro evaluation. She got treated with that thrombolytic, and she got treated within 45 minutes under that 6-minute window. She was then transferred out because of the thrombolytic. She did well. She is basically back to her baseline.
Wow.
And this is why it matters. Having access to healthcare, it does matter. And having access close to your home, it does matter because it will affect your outcome.
Yes. And also, just lastly, the hospital's, its anniversary is 120 years this year. I was curious what you enjoy most about working on the North Fork and at Stony Brook Eastern Long Island Hospital.
So I've been a part of Stony Brook Eastern Long Island Hospital for the past 4 years. And I will tell you, it is a pleasure being on staff there. So just coming out on the North Fork of Long Island, it's just a scenery, right? It's just a beautiful area to work in, scenic views, being near the water. But in addition to that, my colleagues that I work with, the dedication and devotion of our staff to the care of our patients, the community out here. I love the patients that I care for. And I will tell you, our patients are always appreciative. When we have to transfer our patients out because, let's say, they require additional services that we do not have, they're usually in tears. They do not want to leave because one of the things that they always say, we're not going to get the same level of care going elsewhere like we do here at Stony Brook Eastern Long Island Hospital. So I will say it's a top-notch facility. And I am just hoping that we will have more resources, more innovation, more resources poured into this community because it's needed. And as we do that, we will level up as a hospital and we will be able to provide the services to our patients, to our residents here on the North Fork. And we won't have to transfer those patients out. And I won't have to see the tears and disappointment in their eyes when I tell them that I do have to. So that's one of the things that I'm looking forward to. And I really believe that it will happen because I'm already starting to see that change from 4 years ago when I came out here to where we are today. We are making progress and we will continue to make progress. We'll make progress for this community to provide the very best health care and services to our patients and residents.
Absolutely. No, and I want to thank you so much for taking the time to come on today and share all the wonderful information and knowledge about what's happening, especially with the new stroke center, and also just providing healthcare to our community.
Thank you so much. It's been a pleasure. Thank you for having me. And I look forward to maybe having another one of these conversations with you because I think we need to get the word out. We need to educate our community and just let them know that we are here to provide the best health care to them. Thank you.
Thank you. Well, I hope you enjoyed episode 120 with Dr. Candace Cummings. I want to thank you for listening to the Floyd Memorial Library podcast, and we'll see you next time.